therapist. I'll be working with you today. Do you remember me from last time? We worked on the huff cough.
Yes.
Perfect.
Yes, I do.
So we are going to be utilizing that again today. But what we're going to start with is I'm going to be listening to your lung sounds just to see if there's any kind of buildup or anything going on in there that we don't want. If so, we'll implement a technique that we have to hopefully get that mucus out, okay?
Okay.
So we'll start with the lung sounds. In order for me to get the best results, I need to put my stethoscope on the skin. Are you comfortable taking off your shirt?
Yep.
Perfect, go ahead. And then at some point I may ask you to kind of like slide some of the tissue out of the way. And yeah, all right. So I'm gonna be listening to the lung sounds anteriorly and then posteriorly. What I'm listening for is hopefully just like a normal, like I think of it like a wave crashing at the beach kind of sound.
Okay. What
I don't want is like crackly noises or wheezing or anything, but you just breathe normally, and if I need you to take a deep breath, I'll let you know.
All right.
Sorry. Okay. Is it okay if I move the sports bra a little bit?
Yep.
Good, and do you mind moving this tissue out of the way? Perfect. Perfect, other side. Good, one more over here. Perfect, all that sounds great. I'm gonna go check on the back side of the lungs, okay? So same thing over here, I'm gonna move the sports bra straps around a little bit, okay?
Okay.
And kind of go right through here.
Okay.
Two more. Big deep breath for this. Good. Perfect. So I did hear just a little bit of crackling on that right side, kind of on the lower aspect of the lung. So I do have a technique that's called vibration. So what that includes is basically you'd be laying on your stomach, nice and comfortable, some pillows under your hips. My hand will be kind of where I hear the crackling, and I'm just gonna kind of vibrate my hands right on top of it. That's gonna help clear up the mucus, or more so mobilize it to get it moving.
Okay.
And then when you feel like it's coming up, or you feel like you need to cough, you raise your hand. We'll get you a tissue. We'll kind of just put it here now, and you'll do that huff cough into the tissue, okay? And we'll kind of do that for 3 to 5 minutes, or until you're not spitting anything out.
Okay.
All right, you can put your shirt back on, and then go ahead and stand on up, and we'll get you all set up. Yep, right above the hips. If we need to adjust it all, we can. Good, I'm gonna raise the table just a little bit. And then, yep, your head could go to either side or straight down, whatever's comfortable for you. So my hands are gonna be right here. And when you breathe out, you're gonna feel me kind of doing like this, but a little more pressure with that, okay?
Okay.
All right, you just breathe. And just raise your hand if you feel like you need a cough. Perfect. Go ahead and sit on up. Either direction is fine. And here's a tissue. And then do that huff cough into that tissue. Huff, huff. Beautiful. Perfect. And we're gonna keep going until there's nothing coming out of that tissue, okay?
Okay.
There's a trash can right next to you to put your used tissue in. Perfect. Go ahead and sit on out. And again, here's your fresh tissue. And huff cough like you're fogging up that mirror. Perfect. How's the mucus?
It feels kind of like it's cleared up.
Right. And that tissue looks pretty clean. Just to make sure, I'm going to re-listen to that part of your lungs to see if you can hear any changes, okay?
Okay.
You can keep your shirt on. I'm just going to slide it out of the way, okay?
Okay.
Big deep breath. Perfect. Sounds like the ocean breathes. All right, so now that we've cleared out the mucus that you had out of the way, so now we're gonna try a breathing technique called stacked breathing. This is gonna help open your airways as well as facilitate you taking deeper breaths, okay? So, excuse me, good thing we're doing this. So what it's gonna be is you're gonna take 3 small, kind of quick inhales through your nose, kind of like you're sniffing something versus more like a,
Okay.
okay? And then after the third one, you're gonna hold it for 5 seconds.
Okay.
I'll do the counting, don't worry.
Okay.
You're gonna hold it for 5 seconds and then just casually let it out through the mouth, okay? And then once you get all the air out, you're gonna do another huff cough into a new tissue.
Great.
If anything comes out, great.
Okay.
So I'll kind of show you first just so that you're kind of more familiar with it because it's kind of something new that you may have not seen. So it's gonna go. And then I would cough into my tissue. Okay? So ready? On the count of 3, you're gonna breathe in through the nose for those 3 quick breaths. Okay? Ready? 1, 2, and 3. Good, and hold. 4, 3, 2, and slowly out through the mouth. And once you feel you got all your air out, you can huff cough into that tissue. Good job. We're gonna do that one more time. Whenever you're ready. Okay. Good. Hold. 4, 3, 2, and out through the mouth slowly. Good. And huff. Perfect. How you feeling?
Great.